Hello, my name's Lauren.
And I'm Jemiah. We'll be demonstrating today how to properly give subcutaneous injections, specifically insulin.
We'll be covering subcutaneous injections, how to draw them up and administer, and then some key nursing considerations. Okay, next I'll be explaining parenteral medications, a little bit of a background. So parenteral medications are drugs that are injected right into the tissue or the bloodstream rather than taken by mouth.
And then as far as the absorption when insert or giving parenteral medications, it does depend on the type of tissue that is given in. For the subcutaneous injections, you would want to insert it in fatty areas such as the abdomen, your thigh, or kind of below your deltoid muscle. And then although the onset is slower, the duration is actually longer.
And then some common subcutaneous injections would be insulin, which we'll be demonstrating, and then anticoagulants like heparin.
So when it comes to medications and vials, they're not always pre-filled. So the nurse wants to draw up the medications using a proper technique. You want to always make sure you choose the correct syringe as well as the correct size needle, which can be dependent on your person. And then you want to follow aseptic technique to prevent contamination. You also want to check to make sure the drugs are compatible. So in this case with insulin, NPH can only be given with regular. And then you also want to check the expiration dates and make sure you're not giving a med that is expired. Overall, the main thing you want to do is wash your hands and also clean the top vial to prevent potential infection.
Medication administration, the 6 rights. So before you give an injection, you always want to check it's the right patient, right medication, right dose, right route, right time, and right documentation after you give the injection. This is done 3 times to prevent errors, 2 times before you give it, and then 1 time right before administering. And if there's a barcode, that's also a good way as an extra safety check.
Next, we'll be discussing medication education. So before injecting the medicine, you would want to explain first where the injection will be given so that your patient's not caught off guard.
Yes, you do not want to surprise your patient. And then if they self-administer at home, you want to ask, where do you usually inject this in case they have a preference, or do you massage the area afterwards because some medications should not be massaged.
And then if they are self-injecting or if they're new to injections, you want to overall teach them the proper technique and also educate them on the importance of rotating the site to prevent tissue damage. So nursing considerations when it comes to injection sites would be common sites for the subcutaneous injections for insulin. This can be the abdomen and the fatty areas, as well as the upper arm on the outer side, so here, the thigh, and then the upper buttocks.
And then before injecting, you also want to assess the site, make sure it's not red, bruised, hard, or there's any open wounds. And then you also want to make sure that you're again rotating the site to prevent any tissue damage.
And then for the types of tissue when injecting, for subcutaneous injections, you want to get the fatty areas of the body. You also want to angle the needle that you're using. If the patient has more fatty tissue in that area, a 90-degree angle would be accurate to use. However, if they are more thinner patient, or for the most part, we would use a 45-degree angle.
And lastly, just a little considerations for the needle. Use a short, small gauge needle and ensure the correct insulin syringe when drawing up the insulin. And then when you're giving the insulin, you want to make sure that you always put over the safety sheath right after to prevent any needle sticks. And then you want to make sure you dispose of it in the sharps. And then you never recap, reuse, or set down the needle, especially not in the patient's bed. Alright, now it's time to talk about insulins real quick, and then we'll be getting into the skill. So just a quick little overview. Insulin, there's many different types and each work at different speeds, so it's important to know which insulins you'll be giving and when to give them. And then, so today we'll be demonstrating how NPH and regular, how to draw them up and administer.
So the types of insulin that we will be using today in the demonstration are NPH and regular. Regular insulin, also known as short-acting insulin, has an onset of 30 to 60 minutes. It peaks at 2 to 4 hours, and the duration can last up to 5 to 7 hours. This is the only insulin that can also be given through the IV. For NPH insulin, which is mostly mixed with the regular insulin. It's also considered to be an intermediate acting insulin. The onset is 1 to 2 hours, the peak is 4 to 12 hours, and the duration is 18 to 24 hours. For the regular insulin, you would want to give this about 30 minutes before eating, and then the MPH is actually used to maintain the glucose level, so you want to give it about twice a day.
And now we'll be getting into the skill.
Yeah.
So now we'll be demonstrating how to first drop the insulin. So first thing you're going to want to do is read through the chart, looking at allergies, any pertinent history, medications, medication logs, but this is what we're specifically looking for. So for this scenario, it's breakfast time, the patient's blood sugar was 210, so he's going to get 20 units of regular NPH plus 10 units of regular, and on the sliding scale he's resistant, so 210, he's going to get an additional 4 units. So now that we know our dose, let's get started. Alright, so first I'm just going to examine my bottles, making sure that they look intact, they're not expired, they look good. So I'm going to do some hand hygiene. Perfect. And put on some gloves. Looks like a nice day outside. Alright, and so we want to make sure we're doing this in the correct order, so we're going to inject air into N, and then regular, and then drop regular, and then NPH. So now that I got my gloves, I'm going to first clean the vial to prevent any germs. Perfect. Alright, now I'm going to grab my needle, and as you can see, this is the correct insulin needle. Alright, so we're going to inject into NPH first, so I'm going to draw up
20. Perfect. Be very careful. And then just inject the air. Perfect. That's it. And then 14. Can be kind of tricky sometimes with the safety in the way. Perfect. 14. Into regular. Just going to give it a little something something. Alright, air into that, and now we're going to draw up 14 units. You want to make sure no air bubbles. Good. We have 14 units, and in this part you want to be very careful that you don't get any additional, you don't get the regular into there. Give it a little roll. And what happens if you go over the dose? Start over. And why? And why? Because you contaminated the syringe and you might not have the right amount of insulin. So now we're going to go to 34. Be very careful. Perfect.
Alright, sorry, we had to cut the video. Alright, so we just pulled out of NPH. And now we're going to recap the needle. Perfect. Now we have our insulin. We unfortunately don't have any labels, but you would want to label it with the amount, your name, put that on, and now I'm going to get another person, and we're going to do we're gonna check the insulin to make sure we have the right dose. Check. Now. Get this out of the way. Alright, so I'd be comparing my label to here, so 20 we have, and then plus the 14, perfect, and then once more, perfect, we have the right amount of insulin. Now let's go give it to Martha.
Now we'll be administering the insulin.
Come in.
Hi, I'm Jemiah. I'll be your student nurse today. Can you tell me your name and date of birth for me?
Martha Smith, 11-100.
Good, Martha. And then, do you have any allergies?
Nope.
All right, Martha, I am going to be giving you your insulin today. But before that, I'm going to just raise your bed up a little bit. And then, do you have certain areas you administer your insulin when you're at home?
In my belly.
All right, so we'll use that today. Before administering the insulin, I would do my third med check. So I would make sure that I have NPH regular and then the appropriate amount of insulin that we'll be giving Martha. I would make sure I closed her curtain just to give her some privacy. And then as I lift her gown, because we're going to be administering on her stomach, you want to make sure her lower half is still covered, giving her privacy. And then putting my gloves on, I am assessing the site first for any redness, scar tissue, lesions, bruises, things like that. Based on where they placed the insulin last time in her stomach, you would actually want to rotate that site. So place it somewhere else. So I have my insulin here and an alcohol wipe. Okay, Martha, I'm going to just find a spot I'm going to insert your insulin. So you might feel a little coldness.
Okay.
And you want to clean the site in a circular motion, not going over where you already rubbed. You also want to do about 1 to 2 centimeters away from the belly button because you want that fatty area. Get any air bubbles. Then you would find your site. You kind of want to squeeze the area. I can't. But you would want to squeeze that fatty area and hold that skin still. And then because Martha is a little skinny, we're wanting to go at a 45-degree angle. And then we'll just poke. And then insert it slowly into Martha. Good. And then you just want to release. And if she's bleeding, you want to just dab her up with an alcohol wipe cap. Put it in the sharps. All right, Martha, do you have any questions for me?
No, you did perfect. I didn't even feel it.
Excellent. And your breakfast should be coming in soon. Because you got some insulin, if you are feeling clammy, sweaty, maybe under the weather, you let me know because those are signs of hypoglycemia and we don't want that. So if you need anything, you just hit your call light and we can be in to assist you. Okay, Martha? And lastly, once leaving the room, I would then document the insulin administration where I placed the insulin as well as her reaction to the medication.
Awesome. So Martha just received her insulin.
So in conclusion, today we reviewed what subcutaneous injections are and when they should be used, steps of preparing and mixing both NPH and regular insulin, how to choose and assess the appropriate sites that we went over earlier, and then overall the importance of patient education, safety, and following those 6 rights of medication administration.
As nurses, it's our responsibility to ensure accuracy, safety, and patient comfort during every injection. We always want to communicate clearly, use aseptic technique, and teach our patients how to properly manage their own injections when needed. Thank you for watching our presentation on subcutaneous injections.
Bye.
Bye. We hope you learned something. Bye.
Bye.